welcome to chapter 8. We're going to talk about somatic symptom disorder that has to do with somatic symptoms. Um, so, with somatic symptom is basically, in a nutshell, this is what we think of is when you have disorder that has to do with medical issues, kind of like obsession with with something is wrong with yourself all the time. You keep thinking that something is wrong with you medically, which ideally there's nothing going on with you. Okay, so the first one we're going to talk about is called factitious disorder. Factitious disorder. So this one is you just kind of go in and just complain of either physical or psychological symptoms all the time. Okay, that you kind of just keep thinking about that you might have this, you might have that, you might you know even trying to um, make yourself ill, even trying to make yourself sick, just to get the attention of the medical personnel, your doctor, your nurses, or whatnot, just to get that attention. What's worse is something called Munchausen syndrome, which is the factitious disorder imposed on another. So where mom would actually make literally make their kid sick, their child sick, just to keep taking them to the hospital or the doctors to get the attention that they need. So this is part of the factitious disorder, a very huge problem. We have it here. Munchausen syndrome. You could see Arizona is quite prevalent in that. Even there's some local cases right here where you have what we call Munchausen syndrome by proxy, where you have these, a caregiver, induce the symptom in a child, causing the child to get sick and to take them to the hospital, and child continue to get to become sick all the time. Once they go in the hospital, they recover. They feel better. Things have become better. Once they go home, they come back again. Things get worse, and then come back to the hospital again. So horrible thing. Next one is what we call conversion disorder. Conversion disorder is kind of like a mystery, I would say, in a lot of in medicine, even in the psych world. This is where you have these patients, these people, develop the neurological symptoms like blindness, paralysis, or even loss of feeling. There's some of them can't even walk, and we're not talking about people who are weak to begin with. Some of them are completely healthy. They were playing softball, baseball, volleyball, and then all of a sudden, after a week, they couldn't walk. They couldn't walk, and we ran all the tests, doing all the MRI, and there's no indication of anything at all. There's no signs of anything. There's no signs of any illness or diseases at all, but still causing them to, you know, to have these symptoms, and we couldn't figure out why. So we usually classify them as a conversion disorder. The symptom oftentimes do get better over time, but usually comes, with lots of support, and also with physical therapy, occupational therapy as well. Okay, conversion disorder. There's tons of YouTube that actually you could watch that have conversion disorder. There's several cases that you could see. Something. This is one of the one that you're probably gonna see called glove and anesthesia. Part of the conversion symptoms. Basically, your whole entire hand become numb, literally become completely numb. Um, the actual damage most people don't know is there are two nerves running across your hand. Let's say if you have even carpal tunnel syndrome. Carpal tunnel syndrome is only affects the ulnar nerve, doesn't affect the radial nerve. So most of the time, if you have pain, you're only gonna have pain on your ring finger and also your pinky fingers. You're not going to have pain in your first 3 digits. So things like that, where you have numbness all over the hand without any reason, we call that growth anesthesia. Next one is another one that has to do with somatic symptom disorder. Somatic symptom disorder. So these folks, they actually just keep thinking that they have really obsessed, kind of have that obsession, excessive thoughts and feelings and behavior uh, regarding somatic symptoms, so like actual physical illnesses, ailments. They keep thinking that they have all these diseases, these things that they may not have, and they usually do a lot of search online trying to find out what's wrong with them and then come up with their own diagnoses. Really have high anxiety about their health. They just kind of keep come up with all kinds of different types of random or rare illnesses or ailments that they just trying to come up with. Okay. Um, Usually they have, sometimes they have predominant pain pattern, certain pain they have throughout their whole body. So we don't really know what caused these either. We have um, different views that kind of hypothesize in different things. So next one is illness anxiety disorder. This is also another preoccupation, very similar to the somatic one. This is just really, you think that you just have everything. You just have all kinds of illnesses, really more chronic type of illnesses as well. That you have all these anxiety about, all of these symptoms and all of these illnesses. But even though you don't have any symptom, you don't have, like with the somatics, you still have symptom. You have like, oh yeah, I have pain here and there. It must be that disease. It must be this disease. Um, this one you don't. You don't actually have any symptoms at all. You actually kind of normal, but then you kind of just overthink of things. You overthink of your symptoms. Like, oh, just one little cough. Oh, I must have this rare monkey disease, or this disease that only in the rats kind of disease. So I mean, it's a really rare type of disease. This is where we used to call them hypochondriac, people who keep thinking they have all these diseases, even though they don't have any true illnesses or even um, any symptoms to present with, but they just based on little things, they would just overblown their how they have just kind of overblown thinking about these disease or symptoms. Okay, let's see. Next one. These could be related to other type of disease as well, heart disease and other things. Um, okay, and there's stress that you could have in your life, different kind of skills, different type of stress. Usually, you could have going on in your life. Um, okay, I think that's it for this chapter, and I'll see you in the next video. Thank you.